Hello, everyone. Welcome to the first of our summer webinar series. I'm Gina Johnson, and I serve as director of the Post-Secondary Employment Outcomes, or PSEO, Coalition. And this is the first in a three-part summer webinar series. Just so you know, they are all discrete topics. You don't have to attend all three of them. We'd love for you to, but you don't have to attend the first one in order to be able to understand the second or the third. They all have different topics. In this case, Christopher, if you don't mind going to the second slide, I'm going to talk about the webinars that we have. So again, this one, what stakeholders really want to know using PSEO earnings data to answer real questions. Earnings data is one really important aspect of the PSEO data set. The other two aspects are called flows. One is geographic flows and one is industry flows. And we're going to cover those topics in July and August. So again, you're welcome to attend all of these. And I will share that these build on last year's summer webinar series. And I'm going to put a link in the chat if anyone wants to access. That is information about this year's webinars as well as recordings from last year's webinars. So if anyone wants to catch up, again, you do not have to have watched those in order to understand what we're going to talk about today or this summer, but they are a good resource for you to look at how to access the data and what the data are really telling you. This year's set is really digging into how do we use these data to answer really meaty and interesting research questions. So briefly, before I introduce today's webinar presenter, I'd like to talk about the origins of PSEO and the PSEO Coalition in case this is your first time hearing about or attending one of our events. So PSEO started about 10 years ago, maybe even a little bit more than 10 years ago now, with a partnership and a question from the University of Texas system. They wanted to know what happened to their graduates who left Texas. They had great information on their graduates who stayed in Texas after they graduated from one of the University of Texas institutions, but they didn't know anything about their employment or their outcomes after they left. And so they contacted the US Census because they knew they had a solid and good, healthy data set, and ended up working collaboratively with the US Census to create something that now is called PSEO, and now has 39 plus states with at least one institution participating in it, and plus Washington, D.C., plus Western Governors University. And we should have, upon next publication of the data, more than 1,000 institutions represented in the data set. So we've really grown over time, and it's fantastic. So the coalition, which is what we represent, is the representation of the members, the folks who share those post-secondary data with the US Census. So we're not part of the federal government, we're not part of the US Census, they are our partners. And we are a group, Christopher, Annika, and I are on the call today. We are a group who works together collaboratively, hence the term coalition, to figure out and help people use these data better, and also help folks who want to join the data set and be part of it to navigate that process as well with the US Census. So I'm going to do one note about how to ask questions, because we love questions on these webinars. We do ask that everyone stays muted. You're welcome to turn your video on, video off. We understand if you want to keep it off because we are recording and we will be hosting these to our website. But if you have any questions, please just put those questions in the chat. Annika and I will be monitoring the chat, looking at questions, and we will feed those to Christopher as appropriate. And we will save some time. He'll save some time at the end as well to open it up for some questions. We may ask you, if we're not sure exactly what you mean by your question, if you've typed it in the chat, if you're willing and able to unmute yourself, but please only do that if invited to do so to ask a question. So with that, I am going to introduce our speaker. Christopher Pena. Dr. Christopher Pena has many hats. And he, as far as the PSEO Coalition, does two marvelous things for us. He's our data literacy partner. As I mentioned, one of our big goals is for folks to use these data and use these data appropriately and ethically and think about how they can answer lots of different questions with this data set. And so Christopher hosts our webinars and does other things with our research community and other folks to help them use the data and understand the data better. He also is the supervisor of our student interns who are funded with generous support from Strata Education Foundation. We're so pleased to have our interns, and we're so pleased to have Christopher helping them and supervising them along the way. And the reason he's so good at that, and both of these things, is Christopher has a background in institutional research, and he also has a background in instruction and teaching. And so with that, I'm going to turn it over to Christopher and welcome you all to ask questions in the chat, and I will pop back in to feed some of those questions to Christopher.
All right, thank you, Gina, and thank you all for joining us this afternoon. Appreciate your time. And hopefully today we can help you dig into the data a little bit deeper in terms of how you could use this PSEO data to answer interesting and rich questions in your own work. As Gina said, I've worked in institutional research for about 12 years in a prior career track, so I definitely understand some of the questions and pain points that many of you may be facing these days, and PSEO may be able to help you in that regard. So today we're going to focus on the earnings data, and I'll talk just briefly about what those data look like a little bit later. But our goals for today are really centered around helping you to think about what's possible with PSEO data. So we're going to walk through an analysis question from start to finish, from framing the question to interpretation. But I want to stress from the beginning that our goal today is not to study and interpret findings for the sake of the findings. That's obviously a very different endeavor. Our goal today is to really understand how to work with the data and think through some of the challenges and choices we have to make in order to answer those kinds of questions. So I hope you walk away with a framework for understanding the data, know about the limitations and opportunities with the data, how to work with aggregates and subfields for analysis, thinking about both institutions and state level data, and then ultimately how you can communicate your findings in a responsible and credible fashion. So let's start out by framing our question that we're going to walk through today. To start off with, if you're not familiar with the PSEO data, as Gina was talking about earlier, it's a national data set that works state by state to combine both institution level information along with UI wage data from the US Census and state agencies. This is all produced by the US Census Bureau, and it gives us a really nice picture of what happens to our graduates after they leave us. So it measures earnings at 1, 5, and 10 years after graduation, and it reports that in quartiles by state, by institution, by cohort, and by program, which includes both degree level and the field of study, which is represented by the CIP code, the Classification of Instructional Programs code. I've got a link here in the slide that you can check out when we post this on our website later after this session, if you want to learn more about the methodology and the data sources behind this data set. Now, let's imagine that we have a stakeholder who came our way and asked us a kind of general question. I think this is very common in institutional research and institutional effectiveness. Let's imagine we had someone like a donor, a parent, a prospective student who comes with us with this question of, are health professions programs worth the investment? Should I invest my time and money in this kind of degree program? Well, I think most of us would answer yes. We know there's a high national demand for healthcare professionals out there today, and many states are struggling to fill those gaps in the workforce. But we don't want to just make the claim, we want to be able to back it up with information, and that's what the data here can actually do for us. But before we start answering that question, we need to answer some related scoping decisions in terms of how we're going to define the population and sample for study. We'll have to decide, do we want to look at state level or institutional level information or both? What degree level should we study? What program represented by the CIP code? And ultimately, how should we do comparisons to understand what's working and what's better than something compared to something else? These decisions are critical because they shape everything that we do afterwards. Now, before we take that broad question and start to dig into it, we need to frame it more analytically. So let's think through how we could explore this question. We might think about, on the top level, basically, what do our graduates earn? That's a really nice way to frame the analysis. But we might want to dig a little bit deeper and ask about, how do subfields perform compared to that larger health professions group? And we may also want to know, does geography matter? Does the institution that you attend and where it's located have an influence on your outcomes? So let's start with some of those scoping decisions before we really dig into the analysis. As I mentioned, we have, and the PSEO data, we have both the state and institution level aggregations, which is really nice for us because it's prepackaged for us to analyze. Now, when it comes to national level analysis, we don't have an aggregation for the entire PSEO coalition partnership. We just have it state by state and institution by institution. I'll talk a little bit more about that later today and what that means for us to prepare our data. But I want you to recognize that the institution level records, that's where we get the lowest level of detail possible in terms of the aggregation. And then we can cross that with specific degree programs, specific cohorts, and so on. So let's imagine for this analysis that we're going to start with our institution level records, and later on we'll aggregate in a custom fashion based on our analysis needs. Then we need to decide what degree level are we going to study. Well, when you think about health professions, you probably think about graduate level degrees like a master's, and that's very common out there in the workforce. But we also have to think about it in terms of what we can study with the PSEO earnings data. So we took a quick look at the literature, and there are a few key findings that I think are relevant for this kind of analysis. First of all, we learned that associate's degrees are the dominant entry credential for health professions. So that's where a lot of people are starting in their workforce journey. We also know that for many health profession fields, the associate's degree can be a terminal licensing credential. That's really what they need in order to enter the profession that they're looking to achieve. We know too that associate's recipients may later go on to earn higher degrees like a bachelor's or a master's. And we also know that earnings are often front-loaded for certain health profession fields. So given all of that, it makes sense for us to focus potentially on associate's degrees. Another reason for that is because we have really rich data at the associate's level. We can dig down into subfields. But we also, if we think about bachelor's and master's, we're going to have less granularity, especially at the graduate level, because of how the data are prepared for us. So if we really want to get the most bang for our buck, both the aggregate health professions level and then also the subfield, associates makes a lot of sense for us. And that's coded as 03 in our raw data. Now, we also need to think about how we identify what those programs are, and this is an easy one. In the zip code schema, again, that classification of instructional programs, zip code 51 represents health professions, but it does have a lot of diversity inside that umbrella. There are fields like dentistry, medicine, and registered nursing, so we have to keep that in mind as we're doing our analysis. So I think for this study, let's plan to look at zip code 51 altogether, but we'll also plan to disaggregate down to the 4-digit zip code level or the subfield, and maybe focus on registered nursing, which is 51.38, because we know there's a particular need for that out there in the workforce. And then we also want to think about our comparison groups. How are we going to compare different groups and subgroups against each other? Well, it makes sense if we're going to look at the zip code 51 umbrella to compare it against all other programs, all other associate's degree programs. We may also want to compare subgroups within the zip 51 family against each other to see how they perform and if there's diversity in the outcomes there. And then finally, just to give us some meat to this analysis, I live and work in Colorado, so I thought, well, let's study that as a state and compare Colorado against other states in the coalition that we have data for. So we'll keep those pieces in mind as we work through our analysis. Again, we want to be very cautious and remember that there is diversity both within and between the groups when we do our comparisons. So with all of that in mind, we can reframe that very broad question into 3 analysis questions. First off, let's think about the earnings. What do our health professions graduates at the associate's level earn 1, 5, and 10 years after graduation? And how does that compare to graduates of other degree programs at the associate's level? Then we want to think about the subgroups. How does the subfield that a student is pursuing within zip code 51 change from field to field? And how does that distribution of earnings and growth rates across the subfields shake out that we wouldn't necessarily see at the high level 2-digit zip code level? And then finally, let's think about geography. How do Colorado institutions compare to the national distribution of health professions graduates at 1 year? And where does Colorado rank among the states? So that gives us a lot to work with. And I think you'll see today that there are a lot of decisions we have to make in order to answer these questions. Before we get into the analysis, of course, we need to do some exploratory analysis to understand our data a little bit better. So let's walk through some of the key considerations there. First off, for this analysis, I use Python, but you could, of course, do this with R and other programming languages. You could also do this in Excel, although it would be a little challenging for some pieces of the analysis. So just keep that in mind as you're planning your own work. The data come again from the US Census, the PSEO data set, and that's part of the Longitudinal Employer Household Dynamics Survey, or LEHD. And there's great documentation on their website that you can find to, again, dig into the methodology and the data sources behind the scenes. So that's our core data set. We're using the raw data. There's a CSV file that gives you the national data set. We're also combining that with zip code codes and labels so we can actually play with those subfields. And then also we're combining it with a list of institutions and their locations so we can do a little bit of geographic analysis. Again, all three of those data sources are available through the US Census, through the PSEO website, the Explorer tool, and its companion documentation. So once we downloaded and put the data together and then ran through our filters to narrow down to the associates level, we ended up with about 25,000 rows, which cover about 26 states. Now that's 26 states within the PSEO coalition that we have a sufficient data coverage to actually analyze. So that's fewer than the total number of states that we have in the coalition, as Gina mentioned earlier. And we want to keep that in mind when we interpret our findings later on. One of the first decisions we have to think about is the cohort that we're going to work with. The PSEO data are pre-aggregated at different cohort levels to ensure that there are sufficient cell sizes to report publicly. So they give us both individual cohorts, which are different year spans depending on the degree level. And there's also an all cohorts cohort, which is coded as 0000. So the question is, do we look at a specific cohort in isolation? Do we look at several cohorts together? Or do we use the all cohorts cohort for our study? Well, we have to think about what's the benefit and the trade-off for using one versus the other. Typically, I recommend using the all cohorts cohort if you don't suspect that there are significant differences between your cohorts. But it's a little bit challenging because we can't do something like ANOVA, where we could actually look for those differences in means or outcomes more statistically. So with that in mind, one thing that we could do is identify, well, what's the most recent cohort that we have complete data for, maybe up to the 10-year point, and compare that against the all cohort in order to see if there's a significant difference there, at least mathematically. And it looks like the 2006 to 2010 cohort is the most recent one that we have the 10-year data available for, so we can use that in comparison against all cohorts. And this visualization shows you those two outcomes mapped against each other. On the left, we have all cohorts, and on the right, we have a specific 5-year cohort for associate's degree majors. The red line represents our health professions graduates, and the blue line represents all other associate's majors. And you can see, looking at the numbers and the trajectory and the gap, that they're very, very similar to each other. So I feel pretty comfortable using the all cohorts cohort, which is already prepared for us. Another reason you might consider this kind of comparison is if you select a specific cohort like 2006 to 2010, your numbers may go down to a point where you don't have cells that are reported. So the advantage of using all cohorts is, especially if you have a smaller institution or a smaller number of graduates, you can end up with data that give you more to work with from an analysis perspective. Just a few things to keep in mind as you're working with those data. Now, I mentioned earlier that the PSEO data do give us pre-calculated aggregations at different levels, but sometimes it doesn't give us everything that we need. The biggest challenge, for example, is our national aggregation. The data come packaged state by state, but we don't have an aggregate for the entire United States. So one method that we've used in the student intern team is to focus on the median earnings. We get the quartiles, but we focus on the median earnings. And then we do a weighted average of that across our institutions to create a defensible best estimate. Now, of course, statistically, there are some challenges with that, but it gets us pretty close, at least in terms of our prior analysis, to feel good about using that. But when we're making the decision about that kind of custom aggregation, we have to decide, do we want to use a weighted or unweighted average of those median earnings? So I think it's also valuable to consider how that impacts the outcomes that you're going to see in your data. This visualization shows that comparison. In gray on the left, you see the unweighted outcomes compared against the weighted outcomes in red. There's not a heavy difference there for health professions, and a little bit more of a difference on the other associate's majors, but still not substantially different to where I'd feel concerned about it. I would recommend using a weighted average because, of course, institution and program counts are going to vary, and you don't want to have too many differences start to shake out, or basically, you don't want smaller institutions to be outweighed by the bigger ones. So, just something to keep in mind as well as you're doing those pre-calculations for your data. Now, we also want to think about coverage of our information. How well do the PSEO data capture workforce data that we're trying to study? When it comes to coverage for health professions, most of these graduates are going to be W-2 employees, which are well covered in the PSEO data set. In fact, the documentation specifically notes that health professions are well covered out there. The challenge comes with graduates who are self-employed, maybe in the arts, consulting, and entrepreneurship fields, doing something like ensemble employment that may or may not be fully covered in the PSEO dataset. And that can have important implications for our analysis and interpretation. So we want to keep that in mind. For our study, we're looking at health professions. We've got good coverage there. So I think we're solid on that point. In terms of the horizons, 1, 5, and 10 years after graduation, we have really good coverage at 1 year, about 500 institutions in our analysis data set, but it's a little bit thinner at 10 years, about 400 institutions. So again, we have to keep that in mind as we're doing our interpretation. We can also visualize the coverage of institutions within the data set. So what you see here in red is health professions and in blue is other associates majors. And you can see that the percentage of institutions that have sufficient data for us to analyze is very high for the health professions and a bit lower for the other majors. Now, as I'll explain a little bit later, this may be a function of the kind of majors that are represented under other associates majors. Some of them may lean towards ensemble type employment, or the numbers may be so small that they're suppressed in the PSEO data. So we don't necessarily have them to work with. So again, I think the story is we've got good coverage for our health profession students, and so we'll move forward with that information. So now that we've explored our data, let's think about how we can do the actual analysis. We had 3 research questions that we set for ourselves. The first one looking at earnings, the second one looking at earnings by subfield, and the third one looking at geography. Let's tackle the first one to begin with. Our basic goal here is we want to understand the earnings story. Where do students start in terms of their earnings? What does the trajectory look like? And are those earning patterns durable throughout those 3 points in time, 1, 5, and 10 years? So we might examine this through a few visualizations. Maybe we look at earnings across the different horizon points for zip code 51 versus all other majors. And maybe we look at the dollar and percent changes for both groups across the different horizons. I think that would be a great starting point for us to understand what these outcomes are starting to look like. And this visualization shows us exactly that. We saw it earlier where we can see the earnings at the 1, 5, and 10-year points for our health profession students compared against other associates majors. And right away, we can tell a very interesting story here. Our health professions graduates are earning quite a bit more compared to other associates majors. And we see that trajectory is moving upward for both of them, as we would expect, hopefully, for the 5 and 10-year points for all of our graduates. They're earning more across a longer horizon there. You may also notice that the gap between the two is ever so slightly closing as we move towards the 10-year point. And that's an interesting observation for us to consider in the context of the growth trajectory of our health professions graduates. So this gives us a high-level understanding of the earnings outcomes just using the raw earnings medians from the PSEO dataset. We can also dress this up a little bit by adding our quartile bands. So what you see in the shaded red section is the band between the 25th and 75th percentile for health professions. And below that in blue is the band for other associates majors. Now it looks like there's an overlap between the two, and that overlap starts to get bigger as we move towards the 10-year point. So that's something we also want to think about, that we saw a little bit of a closing of the gap between the earnings of health professions and other associates majors as we got to the 10-year point, but then we started to see some overlap in the quartiles as well. So we're starting to get a more complete picture of what's happening with our graduates in terms of the spread of earnings over time. We can also think about it in terms of dollar growth and percent growth over time. We can think about 1 to 5 years, 5 to 10 years, and 1 to 10 years. And we can actually map that out both in terms of the raw earnings and the percent change. And this visualization is very powerful because it shows us that we can see that the health professions are not growing quite as much as the other associates majors. As we're going to see a little bit later, if that starting point is lower, and then we see more growth over time, then of course, as a function of the math with a smaller denominator to start, we're going to see a larger growth over time. And that's of course reflected more clearly on the percent growth on the right-hand side. We see a very big jump for our other associates majors, a 72% growth from year 1 to year 10, compared to only 33% for our health professions graduates. And we may see that that's because those earnings are front-loaded, as we saw from our literature review. Now, our second question focused on digging into the subfields within that high-level two-digit aggregation. So we might want to start by looking at the other majors, the other non-health professions majors within the associate's degrees. Look at what those the composition is. That might help us to understand and interpret our findings. And then we may want to do some comparisons of earnings and growth by subfields within zip code 51, those health professions. This visualization shows us the composition of the other associates majors that we're comparing against. Remember, I said earlier, it's very important for us to think about how we define that comparison group. And when we look at the other majors under the associates umbrella, it's dominated a little under half by liberal arts and sciences. We know from the literature that those fields tend to earn a little bit less, and they tend to be more prone to ensemble employment, which is not always reflected in the PSEO data set. So that may be one reason that we're seeing lower starting earnings for our associate graduates for other majors compared to our health profession graduates. We see a smaller percentage representing business and engineering, and then it goes down from there. There's also a gray bar at the bottom that I think is important to note. There are a number of other smaller fields, for the sake of visualization, aren't shown here, but it is a fair amount that we want to consider, about 16% of that group from a composition perspective. And this is just at the year 1 point. We could also do a similar analysis at year 5 and year 10 to see if that trend holds. Now we want to dig a little bit deeper into zip code 51, the subfields within it. So now we're thinking about the 4-digit zip code level. How do they perform against each other within the health professions field? And right away, we can see that registered nursing comes out on top, having an earnings value of about 65,000, followed by allied health, diagnostic, and so on. And we can see all the other fields that are listed there. And of course, this gives us a lens into the diversity of fields that we see within health professions. One thing I'd like to note at the bottom, you'll notice that alternative and complementary medicine is shaded in gray. And then there's an asterisk next to it that indicates that there's only 2 institutions in our data set that met the inclusion criteria for study. I think it's really important to make notes like that, especially when you're communicating your findings to stakeholders, to let them know that you have a relatively small number represented in your data set, and that will affect how you interpret the findings. For the rest of them, we have significantly more institutions and students covered, so we can feel more confident in the conclusions that we draw about those students. So thinking back to our analysis questions that we framed for ourselves, we decided we wanted to zero in particular on registered nursing, and it does look like they're doing pretty well, and they're shaking out, coming out on top there. Now, this visualization I really like because it gives us a lot of power for interpretation. This is a paired plot visualization that shows us both the earnings over time, so 1 year to 5 year, and it does it by subgroup or subfield within zip code 51. It's going to show us both the earnings values, so the change over time, and the percent change all in the same visualization. I think that's very powerful for us. And if we focus again on nursing, we have 2 options for nursing in our data set, obviously different subfields, but important for us to think about. We have registered nursing and practical nursing, which are both shown in red here. So if we look at registered nursing, in our previous visualization, we saw that they were on top when it came to the earnings value at the year 1 point. But if we look at the growth percentage, they're actually closer to the bottom. They're at 18.2% growth from 1 to 5 years compared to health and preparatory programs, which grow about 71% up there at the top. So this is a common theme that I think you'll encounter with PSEO data. It is sometimes helpful to look at one measure or another, but I strongly recommend you look at a cluster of them together to get a more holistic picture of what's happening. If we only looked at one or the other in isolation, we would get an incomplete picture about what's happening with our graduates. And then again, we could go through and we could see what those starting points look like and the growth over time. Now, our final question looked at geography. We wanted to understand, in particular, Colorado, how does the placement of the institution play out in terms of Colorado versus other states, and then variation within the state of Colorado. So it makes sense for us to look at state level earnings, and we could do that in a couple of different ways, and also to look at institution level earnings in the state of Colorado. These are a couple of visualizations that help us to understand that information more clearly. On the left, we've got a bar chart, very straightforward and simple to work with. And we can see that Colorado sits straight in the middle of our distribution of states. So we can say we are a mid-tier state in terms of the earnings that we can expect for healthcare professionals, graduates. So we're earning about 58,622 compared to a national mean of about 58,554. Very, very close to each other. And that gray dotted line on the far right is showing that national average. Now, another thing I want to point out that is very important for PSEO data interpretation, notice down at the bottom that Idaho is shaded in gray with an asterisk. Now, obviously, in terms of the median earnings at 1 year, they're not as high as other states like Connecticut, Oregon, and Texas. That's just what the data show us. That's not intended to be a measure of institutional or state level performance. I think that's a caveat you really want to keep in mind, especially if you're being tugged towards an effectiveness conversation. In this case, it just happens that we have the one institution in Idaho that are represented in the data. And if you get into the data more deeply, you'll learn that there are other states that have either one or two institutions or a small number of campuses that are part of a single state system within the state. So that's something you want to keep in mind for interpretation as you're putting your data together and you're reporting those findings. The choropleth on the right, I think, gives us a lot of power in translating that quantitative information into a geographic tool for communication. Once again, we can see that Colorado in the mid-level green is doing okay. We're in the mid-tier when it comes to earnings for our health professions graduates. And we can see very clearly which states are jumping out as higher earning graduates versus lower earning graduates for this group of students. Another powerful aspect of this visualization is that it shows us national coverage of our subset that we've decided to study. As Gina mentioned at the start of our presentation today, not every state in the United States is currently part of the PSEO coalition, although she and our other partners are working hard to bring new states into our partnership. But what we see here is also that there are certain states that are not represented in our study sample, and that's because there wasn't sufficient data in order to include them. The calculations just literally weren't there for us to work with. So I think I mentioned earlier there were 26 out of the 39 plus states that are represented in this particular study for associate's degrees for the health professions graduates. And then looking at the state level information within Colorado by institution, we can see that there's an interesting variety from Pikes Peak down at the bottom, about 51,000 for zip code 51 graduates, all the way up to about 67,000 for Otero College. Again, this is not intended to be a statement on institutional effectiveness. This is just what the data happen to be. And then on the far right, we show what those graduate counts look like for context. So you can see how big or small the cohorts of graduating students are. This is very useful because it gives us a lens to think about what could we study next? What's going on at one institution versus another that we might want to dig into for qualitative context? Are they focusing on preparing graduates for rural or urban study? Are they leaning heavily towards medical versus dental programs? Things like that that we would want to consider. So given all of this information, what did we learn about health professions graduates? Well, we can see that our graduates are earning more upfront, but the growth is slower than other fields. We know that they rank near the top ahead of business and engineering. We know that healthcare preparatory programs are showing the highest earning growth. Remember, that was about 71%. Practical nursing starts lower, but grows faster than registered nursing, which is an interesting finding, I think. Registered nursing has the lowest growth among nursing adjacent fields. So although it definitely tops out in terms of the raw earnings, the growth over time is not quite as large as other health profession fields. We learned that Colorado is solidly mid-tier when it compared to other states, and there's interesting variation within the state by institution that we may want to study a little bit further down the road. So taking it all the way back to our original question, are health professions programs worth the investment? I think the data show yes, they are, of course, with caveats, but our analysis indicates that these professions are one of the strongest performing among associate's degree fields, and registered nursing is at the top when it comes to upfront earnings, and there's very solid growth potential for us to consider as well. So that gives us an answer grounded in the data that we can then communicate to our stakeholders from a variety of perspectives. And so it's an interesting way to use the PSEO data to answer a variety of specific questions that tell us a more complete picture about what's happening with our graduates. So let's pull it all together for some closing thoughts, and then we'll have some time for questions and discussion. A few things I'd encourage you to keep in mind if you're pursuing this kind of analysis yourself. Remember that we had to make a number of choices along the way, both in preparing our data and how to analyze the data to answer those questions. The scoping decisions shape everything that we do, so we have to be very cautious about that in narrowing down our sample for study. We want to think about the structure of our data before we start filtering. When you start to explore the PSEO data, you'll see that there are codes for the different aggregations that are prepared for us by the PSEO data set. And so you want to make sure you fully understand those codes and how the data are separated before you start working with them. It's very easy to miscalculate certain measures if you don't fully understand where the data are structured. Make sure that you think about coverage, especially by field and subfield. What kind of quality do you have in terms of the amount of data and the scope of data that you have to work with? If you're going to do custom aggregations like I talked about earlier, for example, for the national aggregation, make sure that you validate those estimates. Do you feel comfortable and confident using them for analysis and sharing that information with your stakeholders? And then finally, think about how different data points can tell different stories. We saw how looking at the percent growth and the absolute earnings change over time told us slightly different pictures of registered nursing and other fields as well. So we want to try to get as holistic a picture as possible. And the great thing about PSEO data is it allows us to answer many flavors of a question from a variety of perspectives. So what can the PSEO data do and what can they not do for us? Well, there's a lot of power, hopefully, as you've seen today. It tracks data, earnings data longitudinally for specific cohorts or for all cohorts grouped together. If you want to do a really robust longitudinal study, you can follow a specific cohort throughout time to look at their outcomes. It allows us to look at the data both institutional and state level on a consistent basis. There are very strong methodological definitions that go into how the data are prepared and shared with us publicly. As Gina mentioned at the start of our presentation, there's been a lot of great work over the last decade plus to make sure that the data really are solid for the kinds of questions we need to answer while also protecting privacy and other considerations. By looking at subfields, we can surface specific findings that we wouldn't see at the two-digit zip code level. So we started with health professions as a whole, and we narrowed down to specific subfields within it. We can do those same kind of comparisons for other fields if that was interesting for us as well. And then finally, it allows us to connect a specific credential to a specific outcome at an aggregate level without requiring the individual level microdata. I think we would all love to have the person level information, but for a variety of reasons, that's just not possible for us. So although we do have aggregated data, there's still so much power in that information for us to work with. But what can the data not do for us? Well, there are some limitations, and especially if you're coming more from a methods perspective, I think these are very important for us to keep in mind. First, we can't separate credential effects from selection effects. So if we think about the influence of a specific degree on the career outcomes from an earnings perspective, we know that there are relationships to associates, bachelors, and masters and beyond types of degrees, but we can't necessarily select or separate that from the fact that there may be high performing students that enter high earning fields And so how do we separate those two? Well, the data don't exactly allow us to do that. You'd require supplemental study supported by the literature, I think, to do that. A big challenge for many of us is credential stacking. Here's the reality of the data. When a student graduates, let's say they get an associate's degree, they're represented in one record in the data set. But if they go back and get a bachelor's degree and then a master's degree, they're represented two more times for each of the degrees that they've earned. So if we look at the student who started with an associate's and later on went to get a master's degree, all of their later earnings would be reflected in their original associate's degree record as it would in the other two records. So we know just from a qualitative perspective that it's likely that their earnings are higher because they later on attained a higher level degree credential, but we don't necessarily have a way to tease that out as we would on an individual level. I think many of us are familiar with doing that work internally to the institution. We just can't do that at the aggregate level with PSEO data. The data unfortunately don't tell us where the graduates work with respect to the earnings data. We do get geography related to the institution, but the great news is there is a separate data set, as Gina mentioned earlier, specifically for graduate geographic earning or outcomes. So we can look at where they went after graduation, where they're employed after graduation. And we can also combine that with the industry that they're working in using NACE industry information. So we can get an interesting picture about what happens where they go after graduation, in addition to the earnings. Unfortunately, we can't control for labor market conditions. Those of you who come from more from an econometric perspective probably recognize there are some caveats that we need to keep in mind with this kind of data. So we can't make generalizable conclusions in certain directions, but we can definitely do descriptive analysis. Cost of living and program mix are also other considerations. Cost of living is something we've addressed with the student intern team by looking at different cost of living calculators, like the MIT Living Wage Calculator, which allows us to look at by metropolitan area, what is the living wage necessary to maintain a sufficient level of living? So your housing, your transportation, your food, and so on. We can compare that against the median earnings for a specific program in a specific area, and then we can see how those two differ for each other. So are you earning enough to live a comfortable living? And then finally, we can't guarantee completeness within the country. Not every state is yet a part of the PSEO coalition, and not every state is necessarily going to be represented in the sample that you choose to study. So again, we're not trying to make generalizable conclusions. We're just trying to study the data from a descriptive perspective for the specific sample that we've chosen for our analysis. All right, that is a lot of information. Let's pause there and see if we have any questions from the chat to discuss with our time left.
Thank you so much, Christopher. It is a lot of information, but as always, you present it in a way that's easy for folks to understand. So I really appreciate it. In fact,
Thank
some
you.
of the messaging in the chat is you actually anticipating questions that people had. So some of them you won't need to answer because you already did, which is unsurprising to me. But one thing I'd love you to, well, one thing I'd like to raise up. I actually answered this one, but I'd just like to raise it up in case folks are on a small device where they can't see the chat as easily. But someone did ask whether census is considering, is there any movement to add 1099 data to the PSEO data set, which, as Christopher well knows, and is as excited as I am about it, Census has developed a partnership with IRS, and this will expand the data that are available. And that's what we're calling PSEO 2.0, which will be some improvements. That is one of those improvements. And currently, we're expecting PSEO 2.0 to launch in late 2027. So that answers that question, but I did want to raise that one up. Christopher, this one is for you. Can you say more about what you mean by ensemble employment?
Sure. This actually came from another project that I'm working on with another partner with the PSEO Coalition, where we're looking specifically at visual and performing arts students as a graduate subgroup. And like many other fields in the liberal arts, and obviously a bit of a generalization, but there are students who don't go directly into your traditional W-2 full-time employment that you would see generally reflected within the PSEO data set. There are some caveats about who gets included and who doesn't. Again, the methodology really outlines that in detail. But there are students who move into employment in the workforce and they have a cluster of different jobs. So they might do this and that in another field. And all together, that's what they do as their employment situation. So those individual employment situations, like maybe a consulting job or gig employment, is not always reflected in PSEO data. And that's one reason we might see lower coverage and even lower earnings for certain fields. So that's something we have to be very cautious about. That's an area that I would suggest the literature can really inform the conversation. We dug really deep for those visual and performing arts students to understand what other studies have shown nationally about that population. And we saw that reflected in the actual PSEO data.
Fabulous. Thank you very much. There are a couple of questions that maybe you and I can sort of co-answer, depending on how they come up. It's kind of a questions about what's next. One, I have a relatively simple answer for, which is when will the in-state, out-of-state filter be added? That we are also expecting with PSEO 2.0. So that's another piece of exciting news that we are expecting. And in addition to that aspect, we will also be able to filter down by the state that folks go to. Currently, it's by census region, but we will actually be able to get the data by state. So if someone, for instance, is in Colorado and they move to Wyoming, we will know that instead of just that they stayed in the Mountain West. Another question that I wonder, Christopher, if I'm going to propose a thought on how you might respond to this one, but question about, is there a plan to incorporate the cost of living data into the application? I don't want to speak on behalf of the US Census because they are the ones who are in charge of the PSEO Explorer tool and all of the raw data that we can download or the publicly available data we can download. And so I don't believe that there is a plan to incorporate cost of living data into their application. However, I did share a link in the chat, and Christopher, I wondered if you could speak a little bit about this. Christopher has been working on projects with some of our student interns, like he mentioned, and they did create a visualization tool that we have available on our website, and I shared the link, that does incorporate living wage. Christopher, is there anything you want to say about that tool since you were instrumental in its development?
Well, I give credit to our interns. I just helped with the process. So full credit to our two previous interns who put in the hard work to actually build that. But one thing I would recommend is look at a variety of different data sources and make sure it matches your analysis needs and considerations. We decided to use the MIT Living Wage Calculator for a variety of reasons. It gives you information by state and by county and by metropolitan area, and it breaks it out by family size. So the number of working adults in the family and the number of children in the family, which I think is very relevant, especially for graduate and non-traditional students who may have that kind of situation. So the way that we built it was you can select a program of study for a graduating institution to get the earnings data, and then select a state that you're interested in exploring and see their metropolitan areas and compare the earnings against the living wage for that particular area. Now, obviously, this is a very high level summary kind of view. It's not meant to be econometric. That would obviously require a more rigorous approach. But I think to find a sweet spot of really understanding what can you expect to earn based on real graduate earnings compared to the living wage information for an area you think you might want to move to, for students in particular, that's a very powerful perspective. Now, I mention that because there are other ways of calculating cost of living and living wage from other institutes and other universities that you may want to consider using. We just chose that one because it made the most sense for our development needs at the time. It's not a preference in terms of quality or completeness. It's just one of many options that are out there.
Thank you, Christopher. And that highlights kind of somewhat another question that I answered, but again, if you want to add anything to, the question was, in addition to state level data, is there system level data like the UNC system? And I shared in the chat that census does not combine institutional data into system data, but some of our partner systems and states have built their own tools. And I
Mhm.
shared the link to our resource library. And for folks that can see that, if you filter by dashboard, you will see all the examples of dashboards that folks have created. Christopher, do you want to say anything about the interns' work on some of those dashboards as well?
Mhm. Yeah, I would just add that that takes us back to those custom aggregations that I mentioned earlier. We do have the institution level and the state level information, the PSEO data set. So with a few of our partners that we've been working with to develop some tools, one of the questions that came in was, could we separate our institutions by the groupings that we use in our state? So maybe it's a system office, maybe it's public versus private, maybe it's 2-year community colleges versus your 4-year flagship institutions, things like that that aren't reflected in the raw data. That's actually relatively easy to do. You obviously need to have a list of how you want to organize those institutions. And then you would just add an indicator in your raw data set to assign them to a particular group. And then you can categorize them that way. Now, in terms of the aggregation for that subgroup, you would probably use that weighted mean of the median approach that I recommended earlier. That's one approach that you could use. There are some more statistically rigorous approaches like a log normal distribution that would allow you to go in that direction. But again, we're trying to find that sweet spot of what's accessible and what's realistic for most developers. So that's a great example of where you can take external data and merge it with PSEO data to get the subset that is really relevant for your analysis.
Thank you for that. I think we've answered all the questions in the chat. So I'm going to just pause and see. Please type them in. If it's too cumbersome for you to type it in because you're on some sort of device that does not allow that or makes that challenging, please do feel free to come off of mute if you'd like to ask a question verbally or use the raise hand function. But while we're watching for that, Christopher, if you want to move to the slide and talk a little bit about the next webinar that you'll be conducting in July.
Thank you. Well, we've got a QR code if you're interested to sign up for our next webinar in July. As I mentioned earlier, we have 3 sets of data. We have the earnings data, geographic flows, and industry flows. So our next session is going to focus on the geographic flows information. It's separate from the earnings data, so keep that in mind. But as Gina mentioned, it allows us to look at where the students are working after graduation in terms of census division in the country. So you can see which students are staying in state relative to the institution they graduated from, and then where they're going after they complete their program. And we've done a lot of interesting work with some of our PSEO partners to examine that exact kind of issue. How many students are staying in state? We think about stickiness of talent. And that's especially important for fields like healthcare professions, where you want to train up professionals and hopefully keep them in your local or state region to meet your needs in the workforce. So those are the kind of questions that you could explore. So similar to today, we'll take a look at some practical questions that you may want to examine using the geographic flows information. And that'll be towards the end of July. And if you found this webinar useful, then I would highly encourage you to come back and join us for that conversation next month.
Thanks so much, Christopher. I just want to thank everyone for your attendance. Thank you for your questions. We are very excited about these data. They are massively useful. I love the earnings data, but I will be honest that I think the geographic flows data are even more exciting. They're kind of, to me, the hidden gem in this data set. And I think as Christopher talks through, if you join us in July, and then again in August, we kind of already previewed that those will be the industry data. There's a lot of nuances and there's a lot of things to think about, a lot of caveats, so to speak, the importance of knowing these data sets. And so having you walk us through those, Christopher, with all of your experience with these data is really very helpful. So I just want to take a moment to thank you, Christopher, for your presentation. Thank you all for your questions. And just to let you know, the link that I shared, which is pseocoalition.org/webinars, we will have the recording of this webinar posted up there probably by next week, although with the holiday next week, give us a little bit of time. And then we will also post, as Christopher shared, the slides so that you can share those, use those as you think through and use these data as well. So thank you so much for joining us and have a wonderful week. Thanks, Christopher.
Thank you.